Today's NHI chat features Dr. Sharlon Lewis of the Wellness Center. Today's topic, diabetes.
So diabetes is actually where your body is not using sugar properly. Sugar is important because you need it for all bodily functions. Almost all the cells in your body are going to use sugar within the cell itself for energy, as you know, this whole big biochemical cycle. But sugar now has to actually get into the cells. So normal function is where your body is producing insulin, and insulin works as a key to open up these cells to allow the sugar in it. So I always tell people, think about it like a village where you have like houses and businesses, and you need to get the people into the business and into the building to actually do the work. So that's how the body functions normally. But what happens with diabetes is a situation where you just have buildings that are locked up. So think now about Road Town, like after we had the storm and a lot of businesses weren't open, but we have all these people floating around and there's nowhere for people to go. So that is what happens in diabetes. The doors are not opening, the insulin is not working properly. That's in type 2 diabetes, which is the most common kind, because about 1 in 5 diabetics would actually be type 2 diabetics. There's also type 1 diabetes, which I will mention, even though it's not a lifestyle type of disease. It's really something that is because of a defect within the person's own body functions, where the body just does not produce enough insulin. So the doorways and everything working properly, but the person themselves are just not producing enough of these keys that are needed to actually open up the doorways. So again, to distinguish between type 1 and type 2, type 1 is usually from childhood or early adulthood, and that is where the body does not produce enough insulin. Type 2 is where your body does not respond to insulin properly, and therefore it cannot open up the cells to allow the sugar into the cells. Both of them are going to result in high blood sugars, but the reason behind it is different.
Yes. Can you tell us what are some of the signs and symptoms of diabetes?
I don't know if anybody caught the interview with Umoja, with Mrs. Vanterpool from the BVI Diabetes Association, where we were talking about these, where 50% of people who actually have diabetes don't know because the symptoms may not show up. When you start to get symptoms of diabetes, it's actually been going on for a while. However, the things you're going to look out for are the 4 T's. So we tired, thin, thirst, and toilet. Okay, so tired, again, remember, sugar is necessary, but the sugar is not getting into the cell where it's supposed to go. So the person feels lethargic, they feel very tired because the energy is not actually getting into the cell to do its work. So the person feels really tired all the time. So they're going to also be thin. So people say, well, why does this happen? It's like because your body is not able to use sugar for energy. What's going to happen is then it's going to start breaking down fat a bit rapidly and not in a healthy way for energy to be produced within the body itself. The next thing is thirst. When your blood sugars are high, one of the ways that your body tries to get rid of it is through the toilet, where you're actually going to be giving off a lot of sugar molecules through the urine. When you get a lot of sugar molecules in the urine, it's like trying to mix juice, so your body's actually going to give up a lot of water along with those sugar molecules. And when you get dehydrated, so your body is saying, oh, I don't have enough fluid, and you get thirsty all the time. On top of that, you're going to be passing all of this urine, so it's going to be producing large amounts of urine because you're just basically drawing all the fluid out to the body. So the 4 T's of symptoms to look out for really would be tired, toilet, thirst, and thin. There are other symptoms, yes, like headaches, blurry vision especially, tingling and pins and needles or weird pains, especially in the legs and the more outer parts of the body, because high blood sugars also affects the nerves and the blood vessel and the blood supply to these parts of the body, and so they tend to feel the symptoms a little bit more early. Organs that we are very, very careful about when it comes to not only blood sugar diabetes, but also with hypertension, would be the 4 organs that have very delicate blood systems. So that's your brain, your eyes, the heart, and the kidneys. Those 4 organs are like the vital organs, and when you have problems with blood sugar and hypertension, those are very much affected because the blood vessels there are just so delicate. It's like a fine lace curtain. and you don't want all this damaging blood and blood pressure and everything to be rushing through your delicate lace curtains in your house. So those get damaged very easily.
I love that analogy.
April, you know that my area of interest is in obesity management, because I myself, when I was in my early 30s, I'm not in my early 30s anymore. When I was in my early 30s, I started having problems with maintaining my weight. So at that point, I realized that I was doing something wrong, and I went on this journey and this search to try to figure out, well, what happens when we get older and we start to put on weight. And it happens to almost everyone. There are very few people, and God bless them, but almost all of us, because of age, we start to put on weight. It is particularly dangerous, however, to put on that weight, especially around the middle section. And we know, April, we have children, so we know it's very easy after you have children, the belly gets stretched out, and you're thinking, oh, well, my belly just got stretched out from the kids. That may not necessarily be the case. It may be that your body is depositing all of this fat around the organs inside the body. And you know what that does? That chokes up everything inside there. And having that sort of excess fat around those organs as well actually causes a lot of inflammation. And from the time you hear the word inflammation, you know something is going to go wrong. So inflammation, that sort of inflammation actually leads to the damage of the cells, and that's what causes diabetes. And it actually can lead to stiffening of your arteries and hypertension. And because you have hypertension, you might have high cholesterol, and then you start getting these plaques being formed, and that's how we get heart disease and heart attacks and strokes. And then because inflammation is high, and I'm going to give a shout out right now to the BVI Cancer Society, you have increased inflammation, and that also leads to increased risk of cancers. So it's interesting, what the fact that we were talking about is that
everything is related.
Everything is related.
So we're talking about diabetes,
right? But everything is related to what lifestyle choices we make, and how it can affect your health overall. So the interesting fact about the waist circumference now is that studies have shown that Black people actually have a lower tolerance for excess weight around the midsection. So what does all that means? It basically means that we are actually supposed to maintain smaller waist sizes. So I had a conversation with somebody, and we were talking about this, that we tend to have bigger hips and thighs, and we deposit fat around the lower half of the body, which is great. A pear shape is obviously much better than having an apple shape, but be forewarned that a pear shape can actually hide a large waist. Okay, because if you have somebody who has a 53-inch hip and then they have a 34-inch stomach, they're borderline going towards being obese on the stomach, but because it's balanced out by the hips, we don't realize it. And the thing is that with black people, people of African descent, people of Asian and Indian descent, once we start to put on that weight around the middle section, we actually are more susceptible, or we're going to suffer much easier from these other metabolic conditions like diabetes and hypertension, and therefore heart disease. So lots of things run in your genes. Cancers are going to run in your genes, diabetes will run in your genes, hypertension will run in your genes, obesity runs in the genes. I had a grandmother who was almost 300 pounds. And because of my lifestyle choices, I have been able to maintain my weight. It has not always been easy, but I made the conscious decision and the choice to lead a certain lifestyle. So sometimes, even after I had my second son, later on in my 30s, I did pack on some weight, and I made the conscious effort to try to, get the weight under control, because I to myself knew how important it is for health. So again, there have been many studies that show that even though somebody has this, what we call genetic predisposition, or it's in your family, if you make different lifestyle choices, you can actually somewhat manipulate the way your genes are expressed. Isn't that amazing? I think that's amazing. Yes. That, once, even if you have it in your family, you're at risk, quote unquote, it does not mean that you're going to have it. You need to know that at that point you need to be more vigilant, and you need to, do that little bit extra. But I am always telling people I would much rather spend money on food, because I love food.
Me
So
too.
I would much rather spend my money on food than to be spending my money on, going to a doctor. Even though I am one, I would much rather spend my money on food than going to the doctor, paying for medication, being hospitalized, and being sick all the time. Because this is what happens. Your body just doesn't feel right. You don't have the energy. You're not able to really perform your best. And like, why would you want to live that way if there's a better way to do it? So
what's the better way?
The better way is lifestyle management. So medicine is really moving in that direction as well, where we're not just trying to treat the symptoms and the effects of a condition. We're actually really trying to prevent. So more and more you're going to find doctors being more about prevention medicine. So what does that mean? Eating properly, and to be honest, eating properly does not mean everybody has to eat the same thing, because what might work for Janet might not work for Paul, and it depends really on the individual, obviously on individual taste as well, because I get a lot of questions about, doc, I need a diet plan, and it's like, no, it's just diet guidance, a lot of times, and that alone helps so many people to just be able to live a better and healthier way of life. I'm going to reach out to the public because next month, that November, we're observing diabetes awareness here in the BVI through the BVI Diabetes Association. The World Diabetes Day is on the 14th of November. So I'm going to encourage everybody to, stop and take a look. If you're listening to this right now, that means that you're interested in your health. You're interested in something that's going on. So I commend you, first of all, for taking that interest. Second of all, then, if the words that I'm saying have touched you in any kind of way, then look at what you're doing and look at what you might be able to change to make that difference in your life. Because not only your life, the life of your children, the country actually depends on these individual choices that we're making.